Harold Theus was hired as an EMT firefighter by Alachua County Fire Rescue on August 1st, 1994. Rising through the ranks throughout his 25-year career with Alachua County, he has served as the fire chief since February of this year. He's an active member of the Florida Fire Chiefs Association, International Association of Fire Chiefs, and currently serves on the board of Santa Fe College's EMS Advisory Council and is the vice chair of the Florida Association of County EMS Agencies. He is a certified public manager and has a bachelor's degree in organizational management from Santa Fe College. Welcome, Harold.
Thank you for having me today. I appreciate it.
So, congratulations.
Thank you.
I think your story is just a real inspiration and motivation for young folks that are coming to work at the county, and just a testament to what dedication and hard work, where it can get you. So,
well, thank you. I appreciate it. It's certainly something that when I started here 25 years ago, I never envisioned myself as the fire chief, but you know, I had some very good mentors along the way that taught me and coached me, and the county has really been an environment where it's allowed me to really just pursue my dreams. And so it's really an honor to be the fire chief of the organization that I grew up in.
Yeah. You know, we were talking before the interview, and you mentioned your mission, and you know, I think of all departments, fire rescue is really mission driven, and in reading your very clear and succinct mission, it just kind of fits right with what you do. So can you just share the mission statement with us?
Sure. The mission statement is so important to what we do, and we encourage all of our members in fire rescue to memorize the mission statement, because it's our bloodline, it's what we do. And our mission statement is public servants dedicated to enhancing and caring for the lives of those in our community through preparedness and immediate response to any and all of life's emergencies.
I'm impressed that you can recite your mission. Not everyone can do that. And just, you know, can you discuss how, just kind of what that mission really means in terms of your life-saving in particular?
Yes, sir. When we break that mission statement down, you know, the first thing that we talk about is public servants dedicated. Such an important thing, important role for fire rescue and anyone involved in public safety or county government. We are public servants. We are there to assist the public in whatever need that they have, whatever emergency they have, whether it's something that we see or identify as an emergency in our eyes is irrelevant. All of our patients or individuals that we go to are our customers. And so the dedication portion of being public servants is first and foremost of what we look for in a candidate for firefighter and what we expect out of our employees.
You know, there's probably no position in the county, firefighters and EMS folks, where training plays a more important role. I mean, your training can be the difference between life and death. So how do you feel about the training of your personnel?
Really is. It's vital to what we do, the training that we put in place for all of our firefighters and our paramedics and all of our company officers. When you think about the services that fire rescue provides, it's such a diverse mix. At one time of the day, you're responding to maybe someone who has fallen and you need to assist them. Another time of the day, you're responding to someone who's in a significant medical emergency of cardiac arrest or a stroke. The next call may be a vehicle accident with extrication, where you've got to pull someone out of an entrapped vehicle. And then, of course, you have structure fires and building fires that our crews need to all be trained on. And so much more than just the tactical aspect of what they do, but also from a customer service point of view. We deal with a wide variety of the public. At one call, we're going to a home that is in a very affluent area of town. The next call, that crew may go to someone who's homeless. So understanding the different dynamics of those patients, of those individuals, and being able to communicate with them and relate with them in their current situation is really of vital importance to what we do. It's a big part of what we stress and what we train on for our firefighters.
You know, in talking to you, it kind of reminded me of the many different situations that you deal with, the many different areas of the county you covered, depending on which service we're talking about. But fundamentally, you have two main branches. You have EMS, ambulances, and you have firefighters. So let's start with the ambulance side of it, the EMS side of it, and I know that's a countywide service. Tell us about that.
So our EMS service, Emergency Medical Services, are ambulances, and in our system we call them rescue units. We have 13 rescue units that cover the 963 square miles of Alachua County. Those 13 rescue units are all on a 24-hour shift. They're in service 24 hours a day, 7 days a week. And then we have a peak load division of 5 rescue units that during our busiest call times and busiest call days are in service to assist us with the other side of our EMS services and what we do. Those rescue units responded last year to 42,000 calls, 42,000 responses they went on, and transported 33,000 patients. And I don't know that the average person in Alachua County thinks that Alachua County's EMS service is as busy as that, but it is. It's one of the busiest services in the state of Florida. And all of our crews, all of our folks on those rescue units are either certified EMTs, and one of them is always a certified paramedic. And in many instances, we have certified critical care paramedics, which offer a more advanced level of training. They've received a higher level of training than just our paramedics do. And so the service that we provide to the public through that EMS service is really phenomenal, what we're able to do with the resources that we have.
The number is staggering, 47,000 calls. When we were talking the other day, you were kind of citing some particularly dramatic examples of what your folks had dealt with. Would you mind sharing some of those? You had told me about some folks that had been the difference between life and death because of our response.
One of the initiatives that we have started is internally in fire rescue, when our crews witness another crew do a good job, perform something that that they believe in their mind is heroic. And as you can imagine, that's a very high bar for our crews. They send an email to an awards team that we have established. And just last month, we had 2 situations where people were in cardiac arrest, and our crews were able to perform life-saving measures and were able to bring them back to life. They regained a pulse, and in one instance, regained consciousness with our crew. We had another situation where an individual was choking, was unconscious because of that, because of their choking, and our crew was able to perform life-saving measures and save that person's life. So just in those three examples, more dramatic situation of where someone's life was saved, our crews perform those heroic measures really on a daily basis. And so it's something that I'm very proud of when it comes to the work that our crews do.
Boy, when you get home after a day like that, I think you can be confident in feeling like you did a good day's work.
It is. They're fantastic, and they work hard to train and to understand the newest ideas and technologies of the emergency medical services, and we really work hard in administration to make sure that they receive the training that they need. And I can't go without saying to the Board of County Commission, and they've been supportive. In 2014, we didn't even have a peak load division.
Right.
And so we started this peak load division to assist us with in-county transfers and out-of-county transfers, but also about 65 to 70% of the call load of the peak load are 911 calls. We added a rescue unit last year, a 24-hour rescue unit, and this year I believe the Commission is strongly considering adding a 14th rescue unit. So this Commission understands the need for public safety, and they've been very supportive of us and being able to meet the need.
Fire services is a rather complicated model, and we'll get into that in just a second, but it's important for people to know that ambulance service, EMS services, that's countywide. Your property taxes, no matter whether you're living in a municipality or in the unincorporated area, are the funding source for ambulance services, and we are the sole provider of ambulance services. I know you also, in addition to reacting to emergencies and that kind of transport, you also do other transport. Tell me about that.
We do. We really have an advanced model for our EMS services that very few counties operate the way that we do. We do rely on general fund tax dollars to assist our EMS services in paying for our expenditures and the things that we need and things that we do. Most of our budget, though, our revenue, is generated from the ambulance fee transports.
Right.
And so what we have done is we have really entered into the market to be able to take non-emergency transfers from different facilities. Interfacility transfers is what we call them. And oftentimes those are hospital to hospital transfers, or hospital to a long-term acute care center, hospital to a rehab center. All of those things generate revenue that offset what our taxpayers have to pay. Really proud to say that about 90 to 95% of our funding comes from those ambulance fee transports. So it's really a great value for the citizen, the resident of Alachua County.
So let's get into fire services, which is not quite as simple as the ambulance service. Just give us a good overview of what you do in the fire side.
Sure. So we have 11 fire apparatus in the unincorporated areas of Alachua County. And the fire service has really changed, even in my 25-year tenure. It used to be, it seemed to when I first began, to be a lot more basic. You ran the structure fires, the motor vehicle accidents, and the medical emergencies. And now that service has really become quite complex because the different technologies that are out there have changed. Now when our crews run a vehicle accident, they've got to determine how that vehicle is motorized. Is it a battery operated vehicle? Is it gasoline powered? They also have, with all the safety measures to keep us safe while we're in those vehicles, really create a lot of hazards for us in firefighting and also extracting a patient from a vehicle.
You may set an airbag off that hasn't gone off yet. Yeah.
Right, and so you have to know where those airbag canisters are located. You have to know where the power unit for those things are and the power unit for how that vehicle is operated. Also, firefighting has become a lot more dangerous. No longer is it just the simple wood burning products in a home, but there are synthetic materials, lightweight construction. Homes burn much hotter and much faster than in days gone by. So we've really taken advanced measures to ensure that our crews are safe. The Commission has added 3-person staffing in our rural fire stations, for example, to make sure that there's enough people on scene quickly for a structure fire. We have enhanced our protective gear, our bunker gear, to make sure that our crews stay safe, our air breathing apparatus to make sure that our crews stay safe, and also tracking modules so that we can track a firefighter from a command vehicle and know how much air they have left in their bottle, where they're located, if there's an activation of alarm, if they're in distress in any way, immediate notification systems, so that we can make sure that our firefighters are safe.
The way the service is provided, do you mind if we dig into that? And I'll quiz you a little bit here. So obviously, if you live in the unincorporated area, Alachua County Fire Rescue is the agency that responds. We have a lot of municipalities, so let's go down the list. Who contracts with Fire Rescue to provide fire services?
So I think the best way to explain it is that Alachua County has the responsibility of providing, either directly or through contract, fire protection in the unincorporated areas of Alachua County, outside the city boundaries. So that's the definition. It's outside of any city boundaries. And so we really partner up with a lot of different agencies to do it in several different ways. And we call it the Fire Services Network. For example, we have 3 non-municipal fire departments that are in Alachua County, or that we partner with in Alachua County. Those are Cross Creek, Windsor, and Melrose. And Melrose is actually located just inside Putnam County. But we pay for their services to come into Alachua County and respond to calls. it's more economical to pay them than it is for us to build a fire station in that area. And so we have a great partnership with those 3 non-municipal fire departments, all of which located in unincorporated or respond into unincorporated Alachua County.
And in the example of Melrose, there's kind of a partnership with Putnam County. Both counties contribute to that, is that
They
correct?
do. Both counties participate to make sure that Melrose is able to provide the services in Putnam and in Alachua County. Putnam County supplies a lot of equipment for Melrose, and Alachua County assists them with staffing as far as financing the staffing of their people.
And then what about the cities?
So if we break that down really into 2 categories, the rural cities, which we will call for this example, the rural cities or rural municipalities are Micanopy, Newberry, La Crosse, and High Springs. And those, if you think about where those cities are located, they're on the outskirts of Alachua County proper. And so what we do is we pay them per call to respond outside their city limits into the unincorporated area. One of the priorities for us when we establish all of these agreements is that the closest unit responds to those calls. We try really to stay away from the jurisdictional turf wars that you may read about or hear about in other agencies, other cities, and even other states. So we contract with these partners, and we share protocols with them, we share training with them, we share radio services with them. So it's really one big family that we work together. I'm in regular communication with all of those fire chiefs and have discussions with them about what's working and what's not working. And so just recently we were able to negotiate new contracts with all 7 of those providers. And then of course the largest one, our largest contract provider, one that we have probably the closest partnership with, is the City of Gainesville.
Sure.
City of Gainesville being 64 square miles, located right in the center of Alachua County. So we really protect that donut around the City of Gainesville. And we developed a unique partnership with them in that for those areas just outside the city limits and really just inside the city limits, we respond or they respond to the critical call types. And that way, those non-critical type calls, we will still send a county unit into the county, the city will send a city unit into the city. But if someone's having shortness of breath or a heart attack or a house that's on fire, you're going to get the closest units responding to those calls regardless of jurisdictional boundaries.
And I remember seeing that kind of list of
Yes.
what is critical and what is not.
There is.
And you know, there were some challenges in kind of pounding out the terms of that agreement, but it was really heartening that both the county commission, the city commission, fire rescue on each side did the work necessary to keep people safe.
They really did, and it was a tough decision for I think both commissions to make because you know I think public safety is important to both commissions, but there's also an economic side to what we do, and so being able to work out that agreement so that city units can stay in the city more, so they're not sent out into the county area for calls that aren't considered critical in nature,
Right.
Was important to the city. So I thought it was a very fair, just type of agreement that we made, and we're actually in discussions right now to have a long-term agreement that will spell out exactly how that's going to take place. We tried it for a year and it's been very successful for both agencies.
So, as if ambulance service and fire service wasn't enough, you're also in charge of the emergency management operation.
Yes.
And some big news from
Yes.
emergency management.
Big-
Tell us about your new
yes.
hire.
Big news. Hal Grebe was the assistant EM director at the University of Florida and an individual that we had worked closely with over many years. The emergency management of the University of Florida stands up for every home football game, and we're actively involved in every home football game by taking care of the EMS services in the stadium. And so we've known Hal for a number of years, and he and Ken Allen, the director over there, do a fantastic job at the University of Florida and their EM department. And we also worked with Hal when we had a controversial speaker almost 2 years ago that came in, and Hal was able to bring all the different agencies together in public safety into one room and get us on the same page and tell us to play nice with each other. And it was really a great success from a emergency management standpoint. And so we had a vacancy for the emergency management director, and we did a national search for it, and we were fortunate enough that Hal applied for the position, was seen as the best candidate for the position. We offered him the job and he accepted it. So he just started in early June, so he's still trying to get assimilated in county government and EM director for a county of a large county. And so we're really excited about what he's going to bring to Alachua County.
And obviously the emergency management effort includes the Emergency Operations Center. I know you do constant training there for different scenarios, but you know, what people are most familiar with is when we have a tropical storm or a hurricane coming, the Emergency Operations Center activates. You obviously are very involved in that. There are things called ESF, Emergency Support Functions.
Correct.
What are the two that you all staff?
Well, the ones that we staff are the ESF, they're called ESF 4 and 9. ESF 4 is firefighting, and ESF 9 is urban search and rescue. And those are two standard ESFs that really are activated during our tropical storms and during our hurricanes, making sure that those needs are addressed.
You know, I never have enough time on these shows. There's so much to talk to you about, but I do want to mention the aid that we gave to our neighbors in Northwest Florida during Hurricane Michael. Tell me about that.
We sent 2 separate crews over to Hurricane Michael in the Panhandle. We sent, in an area called Mexico Beach was where they were located, but we sent our medical support unit. It's a bus, 24 patients that bus will hold, along with 3 advanced life support transports. We also sent what's called a MARC unit, which is our mobile area radio communications system. And we provided all the radio communications, emergency public safety radio communications for public safety in that area through our men and women that serve on that MARC unit. So we were really a valuable resource to the Panhandle during that time of need.
We're going to put up on screen right now how to sign up for Alert Alachua if you want to get constant kind of alerts through text messaging. I want to make sure that we touch on E911 real quickly. Tell me about what those folks do.
E911 in our department is responsible for all the addresses in Alachua County, and that's really an oversimplification of what they do.
Right.
Because it's really quite complex what they have to do, and they use the GIS system, Geographical Information System, to be able to do that stuff, to make sure that the addresses are numerically in the right order, to make sure street numbers make sense, street names make sense. They also are involved in Smart 911, which is a wonderful app also for people to use. Smart 911 gives the citizen the ability to input all of their medical information so that when they access 911, if they have specific medical information, it pops up on the screen for the dispatcher to be able to tell the responder that someone may have certain allergies or on certain types of medications. And so they offer a lot of services to us that take place prior to the units being dispatched.
I would be remiss if I didn't mention those folks that the public really never sees, and those are the folks on the budgeting and fiscal side of what you do. You know, you mentioned that ambulance billing, that whole process is one of the things that keeps the property tax contribution to fire rescue at a minimum. So how about a shout out for your budget and fiscal folks?
I will. We have 299 employees in fire rescue, and probably 15 of the most important ones are in our budget and fiscal services in our finance department, because they are so much behind the scenes. And if it wasn't for them understanding the complexities of ambulance billing in today's world with the Affordable Health Care Act, with all the different state and federal regulations on what we have to do for ambulance billing and private pay billing and medical insurance, and dealing with all the different hospitals, I mean, it's an enormous task that we ask them to perform. We do it in-house because our staff is more effective than if we were to outsource it.
Right.
And we've seen that over the years. And in fact, we have a county just to the east of us that actually contracts with us to provide ambulance billing for their county. And we have a cooperation program where they pay us to do that. So we've looked at a lot of different innovative ways to provide services, not just direct services in the street, but also in what we do behind the scenes.
We're down to the last couple of minutes, but
Sure.
if you can give me some quick answers to, tell me about the unmanned aerial vehicle that we recently got.
Yeah, so we have a couple of those unmanned aerial vehicles.
Drones.
Drones, yes. Drones, more commonly known as drones. Our UAV program has really become very robust, and there's a group in Tallahassee and a group in Gainesville, and we're the group in Gainesville. And so we have already been deployed to different areas of the state to assist law enforcement with missing people. We use the UAV program to assist us in wildland firefighting. We'll put a drone up in the air to see how deep a brush fire may be or a wildland fire so that our crews stay safe. We'll monitor our crews while we're on those brush fires. And we can also use it in hazardous situations where it's just too dangerous to send an individual.
Right.
There are hazmat calls that you have an unknown chemical or an unknown substance that you can put a drone in the air and very high definition video to make sure that what they're going into we fully are aware of.
And obviously we want to borrow the drones.
Yeah.
There was a very important piece of legislation dealing with the well-being of firefighters and EMS folks, the Cancer Initiative. Tell us about that.
Yeah, so our cancer initiative is very important in what legislature did. What we have done to respond to that is we want to make sure that our firefighters who have a much higher risk of getting cancer than the average public because of what they do are safe, and we keep them as safe as possible. So we've put into the budget this year more bunker gear, more protective clothing that they can change out of their gear after a structure fire and then put in clean gear, and also doing more cancer screening, more preventive maintenance.
Great. Well, thank you so much. It's so good to have an opportunity to talk to you, and congratulations again.
Thank you.
And we'll talk to you more soon.
Thank you, I appreciate it.
Yeah.
Hey, all the smoke alarms are here tonight.
I just want to say a couple of things about old Hal here. Let's remember, he's a hero and saved this house and family when he spotted that kitchen fire. You've had a good 10 years. We'll miss you, Hal. Hey, it's Hal's replacement. Check out that new technology.
Here, kid. You'll need a fresh one of these. Rookie.
Remember to replace any smoke alarm older than 10 years and replace the batteries in your alarms every year.
You were supposed to make a right, but you made a left. And it's okay, you found your way. On a personal note, as I was counseling the two of you,